We know you have a lot of questions about coronavirus, and we want to help you get some answers. That's why we've set up a hotline here at News 5 so you can call and leave a message with your question. The number to call is 251-662-3055. Tonight's question is about ventilators. Which coronavirus patients in the state of Alabama will get ventilators? How is that decided? News 5's Cherish Lombard is working remotely from home during this pandemic, and she joins us now live with what she found out. Cherish?
Yeah, this is one of those things you don't really think about until something like this happens, until there's a pandemic. This week, members of Alabama Disabilities Advocacy Program and the ARC of the United States filed a complaint with the U.S. Department of Health and Human Services for Civil Rights, saying Alabama's ventilator rationing plan discriminates against people with intellectual and cognitive disabilities and is in violation of the Americans with Disabilities Act, as well as other laws. Now, the original triage criteria was drafted by the Alabama Department of Public Health in 2009 and revised, then approved in 2010 by the State Committee of Public Health. It details what criteria hospitals should use when deciding who gets a ventilator during a major pandemic like COVID-19. It's based on a three-tier triage criteria model designed by two ER doctors, John Hicks and Daniel O'Laughlin. Tier 1 of the plan states hospitals should not offer mechanical ventilator support for patients with end-stage organ failure, including pulmonary, cardiac, renal, immunological, or neurological issues. Tiers 2 and 3 are up to each hospital. Tier 2 resorts back to Tier 1 and states, quote, withdraw ventilator support from those who failed to respond to mechanical ventilation and other support measures. Tier 3 says to withdraw ventilator support from patients who are currently on a ventilator but who go into a Tier 1 state. So, for example, I'm immunocompromised. So under this plan, if you and I are both hospitalized due to COVID-19, I'm experiencing organ failure, but besides having coronavirus, you're otherwise healthy and we both need a ventilator. Technically, I may not get one, but you probably would. To put this into perspective, according to Alabama Political Reporter, as of this morning, half of the 60 total COVID-19 patients at UAB are on ventilators. Approximately 555 of the state hospitals' 1,344 ventilators on hand are on use in any given day. So that just kind of gives you an idea of exactly what this is. I know it's a whole lot to take in, but again, if you have a question, call 251-662-3055, leave us a message, and we will try our hardest to get you answers. Cherish Lombard, WKRG News 5.